Good afternoon. Thanks so much for joining in. There's no doubt that we have a long winter ahead in Montana and indeed across the nation. Nationwide, new infections are at record levels, exceeding 100,000 for 7 consecutive days. And hospitalizations are at a record level. Yesterday, with 145,000 cases nationally, it was an all-time daily high in our country. Dang near every state in the nation is facing uncontrollable spread. In Montana, we too are facing record hospitalizations and our death toll is on the rise. Public health experts, doctors, and nurses have been joining me at these press conferences for the past couple of months to try to raise the alarm for Montanans. The alarm is undoubtedly ringing loud. It's going to be a long and challenging winter for our state and for our nation. For perspective on where we now stand in Montana, it took a little over 6 months for Montana to reach its first 10,000 cases, but only 25 days to reach the second 10,000 cases, and only 15 days to reach the third 10,000 cases by October 28th. It took 11 days to reach 40,000 cases on November 8th. And for those who think that hospitals at capacity or deaths caused due to COVID-19 are not enough to be concerned about this virus, consider how the rising number of infections impact the livelihoods of those in our communities. In the month of October, 20,052 Montanans became infected with COVID-19. If you take a modest estimate and just assume that each individual who tested positive had 4 close contacts, over 80,200 Montanans should have been quarantined for a portion of last month. In total, that would be about over 100,000 Montanans having to quarantine or isolate for some part of the month of October. That's nearly the population of Montana's largest city, Billings. It's more than the population of Flathead County. It's just about the population of Ravalli and Lewis and Clark counties combined. That's the population the size of Billings away from work, away from school, away from the health care jobs that we can't afford to have gaps in. Or in some cases, those who had to go to work who can't afford missing a paycheck. I've been honest in prior press conferences about the challenges we face here in Montana with implementing further restrictions at a statewide level. Some are unique to our state, and some are due to repercussions felt nationwide from the lack of a federal response to this virus. They are challenges that existed before the election, and they're ones that still exist today. The virus is still here. It certainly did not disappear. Congress has not passed another relief package. They haven't done so since March. I have grave concerns, ones I do not share alone, and that many in public health in this state and elsewhere do too, about sending tens of thousands of Montanans into the unemployment line without any enhanced unemployment benefits. How will those Montanans keep their heat on in their homes this winter months and their families fed? We also haven't seen another round of stimulus checks that could help families get by and stay home, particularly when we're seeing so many instances of quarantine and isolation with skyrocketing cases. I also have grave concerns about the thousands of businesses across our state who no longer have access to the Paycheck Protection Program or have a future guarantee of additional relief because of congressional inaction. I've never wanted to punish the businesses that are doing right in this pandemic, that keep their employees and customers safe. Shutting down those businesses would do just that. Instead, I've put a focus on ramping up our enforcement efforts to try to ensure that more are playing by the same rules to keep us safe. Just like masking up, if we're all on the same page with following public health measures, it will make a difference. To be candid, the additional reality is that we do have public health restrictions in place that are currently not being followed by everyone. I do have concerns that further restrictions also will not be followed, yet continue to consult with state and local public health about options. Hotspot communities like Missoula, Great Falls, Billings, Bozeman, and Butte have implemented stricter measures in various forms, and I strongly urge those who live in those communities to follow those measures. We have a mask requirement in place for all but 5 counties right now in our state. University of Washington Institute for Health Metrics and Evaluation projects that 600 lives could be saved in Montana over the next few months if everyone followed the masking requirement. Please do so. This certainly continues to be a rapidly evolving situation, and we continue to work around the clock to manage this virus to the best of our ability. In no way will our administration be hanging up our hats over the next couple of months, and I'll be working until my last day in office to try to limit the spread and save lives. We continue to look at every day at what further steps we can take and what might be most effective. And through the transition process, also want to do everything that I can to help the next administration, to help set them up for success. That includes continuing to leave no stone unturned on testing supplies and capacity, and further building up our stockpile of personal protective equipment. We also continue to fill resource requests for healthcare workers and other personnel, such as contact tracers, as best as we are able, particularly with growing concerns of the nationwide shortage in healthcare workers. 173 civilian, National Guard, and federal personnel are currently serving on the ground in communities all across our state. This includes the 5 teams that we secured from the U.S. Department of Public Health and Human Services, as well as the National Disaster Medical System team of 36 assisting Billings Clinic and St. Vincent. Additionally, members of my coronavirus response team have offered support to the incoming administration. Been fortunate to work with incredible public servants who've given up their weekends and nights for the past 8 months. State epidemiologists, state lab workers, disaster and emergency response experts, National Guard soldiers and airmen, and more have all developed and will carry on the necessary knowledge to continue fighting this virus and taking care of Montanans. We also have incredibly dedicated public health folks at the local levels who too have given up lives outside of their work to take care of the communities. They check in with Montanans when they have to isolate. They work to notify close contacts. They keep their community informed of case levels, and they educate businesses on best practices. Several local public health experts in hotspot counties have implemented stricter requirements or restrictions, and they always have my support in doing so. Today I'm asking Montanans again to do everything you can to make this winter a lot less challenging and a lot less dark. Do everything that you can to follow public health measures. Wear a mask. Skip that gathering. Go home after work and stay home. Support that local restaurant with takeout. I ask Montanans certainly to do this, not for me. Do it for the many who are working in our crowded hospitals to make sure that you can still seek care. Do it for those in our communities who are making sure that you can get a test or that a business can safely stay open instead of going under. Do it for the thousands of kids who rely on their schools for more than an education, and for the parents working to keep the heat on and put food on the table. We need Montanans to stay at home as much as possible, and certainly to follow the restrictions in place. It's the best weapon we have this winter. I'll now turn over to Dr. Greg Holzman, the state's Chief Medical Officer, and Stacy Anderson, the Chief Epidemiologist.
Thank you, Governor. Back on September 22nd, we mentioned that in Montana, we had been given the gift of time. We had the ability to learn from what happened in Washington and New York and Michigan and what was happening in the Southeast and the West. At that time, we did not have a situation where hospitals were extensively overstretched and death rates were going up exponentially. Nevertheless, we highlighted that case numbers were increasing at that time, and that we were concerned that as we moved into the fall and winter months, we could have dire things ahead. We talked about how we needed to work as a community to address the pandemic, not overburden our hospitals, and keep our schools and our businesses open. To fight a highly infectious respiratory disease in our communities, we need a coordinated response. While many Montanans are following the public health guidance, too many individuals are not. Now in Montana, as the governor highlighted, our hospitals are becoming overburdened. This happening due to the massive number of individuals who are becoming infected with COVID-19. As we stated, most people that acquire COVID-19 have mild to moderate symptoms and do well and recover. However, I do want to acknowledge that our understanding of the long-term effects of COVID-19 and who may be at risk of having them, we still do not know. Nevertheless, we know a significant percentage of individuals don't have mild responses. And while the risks for a poor outcome are highest in those individuals who are older or have an underlying condition, we do not know how any one individual will respond to this virus. Currently, we're investigating 3 cases of individuals with possible multi-inflammatory syndrome in children. Thus, with the widespread of this novel coronavirus within our communities and the significant percentage of individuals needing advanced care, the current stress on our public health and healthcare system right now is real. Healthcare workers are becoming stretched, and public health departments cannot keep up with the contact tracing. Some schools have started to close, and businesses are facing a multitude of challenges. Less than 2 months ago, we mentioned that COVID-19 related deaths had moved to the top 10 leading causes of death, but were not near the 3rd leading cause of death as it had been noted in the rest of the United States. We can't say that anymore. While current provisional data, the number of COVID-19 related deaths in Montana is greater than 470 individuals. If we compare that to the average per year deaths of the last 5 years, that would make COVID-related deaths the 4th leading cause of death in Montana currently. Sadly, this is comparing 9 months of COVID data to 12 months of historical data. With the delay in reporting, we suspect that the overall death numbers for COVID-19 related deaths in Montana are greater than are currently being reported. These are death statistics, numbers, which we cannot forget represent individuals, peoples, human beings, parents, family, and our neighbors. And yet deaths are still only part of the picture. This week, as the governor stated, we hit the highest level of hospitalizations of COVID-19, both in Montana and the United States. These are our hospitals working, there are hospitals working beyond their bed capacity. This morning's report, we had 4 hospitals that were over 100% of their capacity. I don't bring this up to scare people, but we need to be very clear and respond now. Otherwise, some of the darkest days could be before us. We cannot sit around and wait for a vaccine, as even under the best circumstances, we will not have a vaccine in widespread use during these winter months. We need to work together every day, young and old, to decrease the amount of disease in our communities. We need to continue widespread testing as best as our supplies allow. And if you have a positive test, follow the guidelines and isolate yourself. You could even help out local public health by notifying your close contacts that they should quarantine and wait to hear from their local public health department. And just to remind people, if they're considering what is considered a close contact, that would be individuals who have been close to you from 2 days before you started to have symptoms until you were isolated for 15 minutes or more during a 24-hour consecutive period. If you never had symptoms and were tested positive, then it would be 2 days before your positive test until you were isolated. The option to move back to an earlier phase to keep people at home and decrease individual interactions would definitely help. However, like the governor has stated, contrary to the past spring, there is no federal money to assist individuals with weekly $600 checks. And thus, if we were to move back to phase 1, families who live paycheck to paycheck would be in dire straits. While our understanding that the federal government will be working on a new stimulus package, we cannot wait. With the resources that we currently have, we need to maximize our testing and ask everyone to follow these simple public health guidelines. Businesses, please ensure that individuals that work for you or visit your establishment are wearing masks appropriately and are physically distancing when possible. Everyone, please reconsider any social gatherings. 3, those individuals at higher risk or around individuals at higher risk, take all necessary precautions. Can you work from home? Limit your interactions with people to the best of your ability. Stay home if you are sick or know you have been exposed to someone with known COVID-19. I could go on, but you have all heard the guidance multiple times before. Plus, you can keep up with the latest information at the CDC website, our website, or other reputable sources. And also, really consider your holiday plans closely. This is not the time to be having any large family gatherings. Again, we don't bring this forward to scare individuals, but to honestly voice our concerns and plead with everyone to please work together. Use good, scientific-based common ground to help us address the pandemic while understanding important issues like housing, income, businesses, sustainability, etc. Please stop the arguing about what one does not want to do and ask yourself, what can I do? What can we do to help protect our communities and decrease the stress and burden on all our frontline workers? Let us all work together, public health, community health systems, chambers of commerce, county attorneys, police chiefs, citizens, everyone. I think I'll go back to something that we've said over and over again, and in this time it means more than ever. Really, this is all on us. Thank you. I'll now hand it over to Stacey Anderson.
Thank you, Greg. Good afternoon, everybody. I'm here to talk to you again about an update on the data of cases reported in Montana. Since March, we are now at 43,031 cases, Montanans who have been diagnosed with COVID-19. This means that 1 in every 24 Montanans has been diagnosed with the disease. Last week, over nearly 7,300 cases were reported in Montana. That's a 29% increase from the previous week, and it's over 1,000 cases reported each day of last week, which is a record for us. Nearly 500 Montanans have been hospitalized, and you've heard much about that from Dr. Holtzman and the governor as well. 472 Montanans have died from COVID-19 to date, and as Dr. Holtzman mentioned, we expect that number to increase. Nationally, we're approaching 240,000 deaths. It's 240,000 people who aren't going to be here this holiday season. So on that note, I want to talk a little bit about the upcoming holidays, especially Thanksgiving. We're all tired. We all miss our families. We want to spend time with our families. The risk, though, is just getting to be too high in some places in Montana, in most places in Montana. We're encouraging you to work together to keep the communities as safe as we can. So think about how you can modify your plans to reduce the risk of spread during the holidays. The risk of transmission will increase based on a lot of different things, including the rate of transmission that is currently happening in your particular community, the size of the gathering you're contemplating going to, whether or not you have to travel to get to that gathering, the duration of the gathering, and the number of people at the gathering, and their behavior in the 2 weeks or so prior to the gathering when they may have been exposed to COVID-19 and could theoretically arrive at the gathering while infectious. So rather than tell you what you can't do, I'm going to try and propose what you can do this holiday season. So think about things you can do, like I said, to reduce your risk. Limit your Thanksgiving celebrations to the people that you're around all of the time anyway, your household members, your close family members who would be considered your contacts in any case if you were diagnosed with COVID-19. You can gather virtually. I know a lot of us are really tired of Zoom calls and Zoom meetings, but it is a safe way to see your loved ones and celebrate together safely. You can prepare and deliver meals and care packages to people in your community who are at higher risk, who probably should not be celebrating with others, with large groups this year. When you're doing your holiday shopping, shop online. Consider shopping local, stay close to home, and support your local businesses. Watch the sporting events and the parades from the comfort of your own home. Now, some of you are still going to continue to go to events and travel. So here is some advice for that. If you're traveling this season, wear a mask in public settings and wear it appropriately, over your nose, all the way under your chin. Try to maintain that 6 feet of distance from others when you're in public places, if you're in an airport, if you're in a restaurant, etc. Try to keep that social distance between you and other people you don't know. Wash your hands often and wash them well. Avoid touching your eyes and your nose and your mouth if you can't do that. Use sanitizer if you can't wash your hands with soap and water. If you're going to gather, try to gather in smaller groups and make sure you put some safety measures into place ahead of the gathering, and make sure people who are coming are prepared to do those things as well. This means you want to make sure you're cleaning and sanitizing surfaces in your house or where the gathering is going to be frequently. Wash your hands. Designate a place for your guests to wash their hands before and after eating. Try to maintain the social distancing as best you can. You know, a lot of recommendations are talking about moving activities outside, and we know that that's probably not possible in Montana, but if you can, try to get that distance between you. If the weather doesn't allow that and you have to be inside, try to make sure you have adequate ventilation. Crack a window if you need to. Make sure you wear masks. Make sure, and the other thing you can do is that rather than having a potluck type of serving at a meal, designate one person to serve the meal. Give them that job. Make sure they're wearing a mask. Make sure they're serving people individually, one at a time, with appropriate social distancing in place. Also, because we're headed into the holiday food season, I'd be remiss if I didn't remind everybody to follow food safety and preparation guidelines so that we don't have other types of foodborne illnesses in our lives. Cook that turkey thoroughly. Make sure you wash your hands when you're handling food and after. And of course, if you haven't already, we advise you to get a flu shot. Flu season's just around the corner. We haven't had any reported confirmed cases of influenza yet here in the state, but it's coming. So you can protect yourself and others by also getting that influenza vaccine. And last, back in May, there was a haiku that I saw going around social media, authored by Mary Merrim, and I think it's fitting again now. It goes like this: "We isolate now so that when we gather again, no one is missing." Thank you.
Thanks, Stacy. Thanks, Doc Holzman. We'll now open up for questions. If you'd like to ask a question, you can press 5-star. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. If the question that you had was previously answered, you can press 5-star again, and it'll take you out of the queue. First phone question.
Hi, Governor Bullock. This is Maritza Georgia with NBC Montana. I have a couple questions. My first is that the latest White House report says we need more testing across the board. And I know, for instance, in Missoula County, if you're even a close contact but not symptomatic, you cannot get a test. What is being done right now to expand testing so that we're not the worst in the country for our positivity rate?
Do you want Jim? I have Jim Murphy, the head of the Infectious Disease Bureau.
I think with respect to testing, we do have a lot of good things going on in Montana right now. We have received some new federal resources with a rapid test, and we are on track to have about 230,000 of those coming into us by year end. We've been getting reliable shipments of 8 to 20,000 of those a week, and we've been pushing those out to facilities that need to test mostly symptomatic people is the best use of this test. We've been supplementing that with continued PCR testing, and the testing that we've been doing has been at what seems like record levels for us. Yesterday, just coming into the state laboratory system, for instance, we had over 6,000 tests just come in yesterday that got processed with our state lab and our partners. So the volumes are really high right now. They could probably be higher. We are working with some partners to do some saturation testing in some of the higher risk areas, and we hope to have those efforts going on soon. In addition, we have been able to do some smaller surveillance site testing in communities like Cascade County. We're talking with Yellowstone County about that, as well as some of the tribal areas. So the need for testing is high, as it has been all along, and we're working to meet that need as much as the federal resources will allow.
And Marita, I guess I'd only add a couple things, one of which is that, over the last 4 weeks, we've done about 134,000 tests. Directly to your question, though, also from look, you said that some people that are close contacts that are asymptomatic aren't able to be tested. I mean, if you're asymptomatic and you're a close contact, it's still the same. You need to quarantine for 14 days because you could well end up, even if you were asymptomatic at the time of testing, could end up symptomatic thereafter. Is that what you were going to add? Did you have something else, Doc? Oh, and I'll have Doc Holzman talk a little bit about the Binax, and I know you still have one more question, Maritza.
I don't know if you were getting into this also, but there's been a lot of talk from the federal government about increasing of the antigen testing in the communities, and that's something that we are definitely supportive of. Everything that's coming into here, we're quickly getting out to the different communities. The amount of testing that is being suggested currently from the federal government, the supplies are not meeting that ability at this point in time, and hopefully there should be some more antigen testings coming online and other ways. But as soon as we get these type of tests, we are quick to try to get them out to the community where they could be best used.
And you had another
All right,
question,
thanks so much
Maritza?
thanks so much to all three of you. And I'm wondering about today I know that there was some kind of glitch with uploading numbers from some counties to the dashboard. I mean, I see one new case in Cascade County, 0 in Lewis and Clark, 0 in Butte Silverbow, and I was told there was a glitch in uploading some numbers. I'm wondering if you know about how many more cases we should have seen today, or if any deaths should have been on that dashboard.
Yeah, go ahead, Stacy.
Yeah, so thanks for that question. The information that we get to upload and populate our map data comes from our surveillance system. And when we pulled the data from that system this morning, those are the cases that got uploaded to the map. So it could very well be that some of those counties were unable to get all of their cases entered in time. We also have been doing some reconciliation with counties. As you heard earlier this week, we've upgraded our system and are working on reconciling cases with counties to make this transition complete. So because of that, we've been maybe subtracting some cases that have been deemed to be not a case or duplicates. So I would say a lot of this falls under that reconciliation of cases umbrella, and we're hoping moving forward things are going to be moving along much smoother.
Next phone question.
Hey, Governor, this is Holly Michaels. How are you doing?
Good, Holly, how are you?
Good, good. I wanted to ask you, given the news that we've seen over the last couple of days about a potential vaccine, I'm wondering what work you see before you and your office in the next month and a half to prepare the state to be able to distribute a possible vaccine. I'm thinking about things like cold storage or identifying populations that would be vaccinated first when supplies are pretty limited.
Yeah, we've already been putting together a vaccine distribution plan. I'll turn it over to Jim Murphy.
The vaccine issue is moving quickly. Unfortunately, the federal government has been working with all the states to plan for this over the last couple months. So we have started the planning groups, as the governor stated. We have identified several cold storage sites capable of supporting one of the vaccine products that requires kind of an extreme cold temperature. There's others in the pipeline that will probably not require quite as extreme handling as the Pfizer package. So plans are being made to do this. We are setting up our planning groups to work on this, both internal and external planning groups to address some of the issues that we're going to face here. So we're optimistic that we're in as good of a position as anyone right now to be able to take receipt of the product when it becomes available and work with our partners, both in the private and public sector, to make sure that vaccine is administered. As far as the question about the target groups, a lot of that is plotted out for some of the highest risk individuals so far. That's considered phase 1 by the federal government. And formal recommendations on what happens in next phases, that guidance is still under development, and we look forward to getting that from the federal government. But phase 1 is pretty well lined out for those at highest risk, including healthcare workers, our American Indian communities in Montana, as well as the elderly populations, especially those in congregate settings.
Next phone question.
Good afternoon, Governor. This is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding this chance to ask questions.
You bet.
I'm curious. Thanks. I'm curious how frequently current coronavirus leaders under your administration are meeting with Governor-elect Gianforte's team, and what topics or issues are prioritized in those transition meetings.
So my staff has had initial discussions with the governor-elect's transition team. We've offered the support of the coronavirus team to the incoming administration. There have not.
And has he taken you up on that offer?
What's that? I think there's been a constructive discussion. There haven't been any meetings to date.
Thank you.
You bet. Mike.
meetings with the Gianforte team, is there anything that you'd like to emphasize for them, or that you're hoping that they may be considering as a priority?
Now, look, I mean, we will provide information, everything from briefings and meetings, familiarizing the team with how things are run at the state lab, how things are run at disaster emergency services, sharing relevant documents. But like at this point, as they're sort of getting their legs underneath, telling them what they should be focusing on is probably a little bit premature.
Governor John Riley, Montana Television Network. Businesses right now are some of the, especially our Main Street businesses, are some of the biggest impacted by COVID, especially as cases continue, and some small businesses having to shut down after one employee catches it. Is there any look right now about any additional support moving into the winter months, or the reallocation of CARES Act funding that was not spent in those initial programs?
Yeah, I mean, John, the problem is that there has been no congressional action since March. So of the $1.25 billion that we have, $1.23 billion of it has been committed. $900 million is out the door with 32 programs, continue to pay out grants, and as well as reimbursements of those submitted. Going to be meeting with staff to determine what leftovers there might be and how best to use that before the December 30th pipeline. But that's the challenge, right, is that the Paycheck Protection Program is gone. And we are 8 months past that, and there's been congressional inaction. Individuals, not just the businesses, the employees who then have to quarantine or isolate. So, well, I would like to see, and I still remain hopeful that maybe Congress will get its act together. There's very little that can be done from the state level for those businesses at this point.
Governor Bullock, Zach Kaplan, ABC Fox Montana. So it was mentioned a little bit earlier about the Pfizer vaccine in particular. It has to be stored at 100 degrees below Fahrenheit, below zero that is. You know, when you think about the rural areas and getting them this vaccine, what concerns are there at this point regarding the storage of the vaccine, and what solutions are there to make sure that those can be mitigated?
Yeah, and Zach, that's one of the things that they're working on from the perspective of both where there will be assets or places that could store, and the challenges of a 147,000 square mile state.
Just to follow up on that, obviously we've talked about people who've been non-compliant from the get-go, whether that's wearing masks or following protocols. What solutions are there at this point at the state level to make sure that people will actually get the vaccine once it becomes available, particularly people who've just been non-compliant from the get-go?
Either of you have thoughts on that? All right, so the question is, like, if someone is offered the vaccine and doesn't want to do it? What concerns do you have that people will be resistant to even getting the vaccine? I'm hopeful that certainly everyone in both the eligible populations, then as it expands, will actually get the vaccine. Next phone question.
Hi, this is Jonathan Hedinger, Montana Free Press. I wanted to follow up on what Dr. Holzman said, that 4 hospitals were over 100% of capacity. I was wondering which hospitals it was, and also if you could help explain what that means for level of care and things like that. I saw the Wall Street Journal said that Billings Clinic was unable to accept ambulances in the emergency room. So what does it mean when hospitals were at or above capacity?
Thank you for that question. It means that we're under a lot of stress. Luckily, the hospital systems within the state of Montana, even though they're representing different organizations, different parent companies, I've been super impressed by the way that they are all working together. So we have morning meetings every day, Monday through Friday, and we get the papers on Saturday and Sunday of how many Staff beds are available in each of the larger PPS hospitals. We also know what ICU availability is, vent availability, and all of these other issues. This also helps them to understand where transfers can be made, whether it has to be because there's diversion from one hospital to another or from the community access hospitals that will be moving in. We are also putting together a program that's actually going to start this evening to help the hospitals coordinate transfers and finding the closest and nearest appropriate bed for patients that may need in-house hospitalizations. All the hospitals that are being extremely stressed are doing many different things to compensate and care for individuals beyond their bed capacity, whether that means doubling up in some of the rooms. Some of the patients are staying in the ER probably longer than they would like, but we'll get them up to the room, but make sure they get the absolute appropriate and high-level care that they need before they can be transferred to a room. So all this plays into it, and like I said, the numbers kind of go up and down, but over the last couple weeks, just watching these numbers, it's very concerning, and we really need to stop the faucet of the number of patients that are coming into these hospitals.
Next phone question.
Hi, Governor. It's Matt Voice with KHN. I wanted to ask if you're planning to continue to enforce your mask directive in time left for additional lawsuits. And secondly, should Governor-elect Gianforte continue your mask mandate and other directives when he takes over?
Matt, to the first, yeah, we'll continue to work with local jurisdictions when it comes to possibilities for enforcement. If that enforcement isn't occurring at the local community level, and as I responded to Mike Dennison, that look, at this point, before telling the next administration what to do, I want to give them a chance to get their feet under themselves. All set? What's that?
Thanks, Governor. Just wanted to follow up. Do you have any plans to change your pursuit of the 5 lawsuits in Flathead County right now with your time limited?
One more time, I didn't understand what you're saying, Matt.
Do you have any plans to drop the 5 lawsuits, enforcement lawsuits in Flathead County?
Yeah, so no, those
another
actions,
administration.
you bet. Those actions are actually, I think the hearing is happening today in court in Flathead County. And look, the intent of all of these enforcement actions certainly isn't to punish businesses. It's actually to get businesses to comply. As always, and we're also more than willing to work with any business interested in following the public health requirements. But expressly to that, with the actions, I think that it's actually in district court right now in Kalispell. Great. Thank you all very much for tuning in, and please do take the cautionary words of Dr. Holzman, Stacy, and myself seriously. It's a difficult time in Montana. It's a difficult time all across the nation when it comes to COVID-19.